Today I will explain on how to take resting blood pressure manually. So first, the equipment is we are using sphygmomanometer or sphygmo and also stethoscope. So this test is relies on vibration that made by blood against the arterial wall. So the procedure, first you want to have the patient to sit down on a chair and have them to be calm for about 3 to 5 minutes. But if they are anxious, nervous or crying or something like that, have them to sit still for 3 to 5 minutes, sitting in the chair with their leg uncrossed and their arms are at heart level. Then you get a cuff, and you need to make sure that you have the right size of the cuff. If the cuff is too large or too small, you will get an inaccurate reading, which is not good. So whenever you put the cuff on the patient, take a look at the patient arm. So if you see that there is a little in their arm area, so probably you need a smaller cuff. Okay, then put the cuff on the patient, and on the cuff you will notice that this small little arrow, and you have an arrow down that say left arm, and you have an arrow down that will say right arm. So if you are using the left arm, you're going to make sure that the arrow is literally right on or slightly above that brachial artery. Then you take the stethoscope and put it over the brachial artery. Then you are going to inflate the cuff with rubber bulb. So here I have drawn the meter. So it will start right here, and then you will inflate and it goes up. So when you already inflate to 180, okay, then you are going to letting out the air to 2 to 3 millimeter mercury, and you are going to do it slowly. Okay, so you will see that the needle, and it will just start going slowly, and all of a sudden you will hear a buff sound. Okay, so we pretend that the buff sound occur at 120 marks. So that is the systolic. So the systolic is 120. Then you keep going and you hear the noise, and then until all of a sudden it stops, and you make know where it stopped, and let's say it stopped at 70 marks. Okay, and then that is the diastolic. So meaning that the patient blood pressure is 120 over 70. So for the normal blood pressure is 120 for the systolic and 80 for the diastolic. Okay, for the tips to take a resting blood pressure manually, the first one is you have to use the correct size of cuff, and then you have to wait 30 minutes if the patient has ate, smoke or exercise. Okay, and then don't take the blood pressure in the arm that have AV shunt, mastectomies, and also blood clot. Okay, that's all. Okay, the next one is contraindication. They have two, which is absolute and also relative. Okay, for absolute, it's an event or substance that could cause a life-threatening situation. A procedure or medium that falls under this category must be avoided. For example of absolute contraindication is unstable angina, uncontrolled symptomatic heart failure, and also acute myocarditis or pericarditis. Okay, for the relative, caution should be used when two drugs or procedure are used together, and it is acceptable to do so if the benefits outweigh the risk. So the example of the relative contraindication is left main coronary stenosis, uncontrolled metabolic disease, and also ventricular aneurysm. So which of these contraindication need to stop immediately is absolute contraindication. And then the component of heart-related fitness testing, there are 5 heart-related component, which is body composition. So the testing is a BMI or body mass index, WHR, waist hip ratio, and also skin fold. Then the next one is flexibility. You will go testing for sit and reach to test our ROM, range of motion. Next one is muscular strength. We will use the test of 1 RM. And then the next one is cardiovascular endurance, which have example for 3 tests. We automate to test for oxygen consumption, and then 2.4 kilometer test, and also YMCA 3-minute step test. And the last one is muscular endurance. We will do curl up test and also maximal number of push up that we can do. Okay, that's all. Okay, next is YMCA submat test. Okay, this test is a psychoergometer test, which is an aerobic test. Okay, based on the subject heart rate response to several sub-maximal workload, so we can predict what workload and therefore the VO2 max. Okay, that will have reach if they have continued until their maximum heart rate. Okay, for the pre-test, calibrate the cycle ergometer and check all the equipment is function. And then you need to explain the test procedure first to the subject and perform screening of health risks and obtain the informed consent. Okay, the next is the advantage. Okay, this is the simple test to administer, reasonably accurate and appropriate for ECG monitoring during exercise. And then for the disadvantage, the test score can be influenced by the variability in a maximum heart rate in individuals. It will underestimate the fitness of those with a high maximum heart rate and overestimate fitness with advancing age. As it is performed on a cycle ergometer, this test would favor the cyclist. Then the next one is physical preparation. Okay, you need to avoid heavy strenuous exercise for the 20 hours prior to testing. Then do not exercise at all on the day of testing to ensure you are well rested. You need to wear an appropriate clothing. Okay, for example like shorts, track pant, t-shirt, singlet or sport top, and a non-slip athletic footwear with lace securely fastened. And then you need to remove restrictive jewelry, watches, bracelet or hanging earrings that may get caught in the equipment. Okay, you do not participate in the testing if you are suffering of any injury or illness that is likely to worsen as a result of participation, or you are unwell and not in a good health. And then you need to be sure to warm up prior to the commencement of testing. And then after the testing, you need to cool down appropriately. Do not sit or lie down immediately following the maximal exercise. Then following the completion of the testing, continue moderate to light aerobic activity like jog or walk for 5 minutes, and then followed by some like stretching for both upper and lower body. I think that's all. And this is my answer for the neuromuscular control questions.